Hello, and welcome to the Naturopathic Medicine talk from Medicine Talk. I'm Dr. Eli Camp, and I'm going to go over the basics of this medicine today with you. The information contained in this Medicine Talk self-study course is presented for educational purposes. Nothing contained in this presentation should be construed nor is intended to be used for medical diagnosis or treatment. It should not be used in place of the advice of your physician or other health care provider. Should you have any health care related questions, please call or see your health care provider promptly. Always consult before embarking on a new treatment, diet, or fitness program, and you should never disregard medical advice or delay in seeking it because of something you have read in this presentation. By continuing, you're indicating you agree to the conditions outlined. So today we're going to go over the basics of naturopathic medicine and talk about your health, your rights in choosing different types of physicians, choosing a doctor. We're going to compare naturopathic doctors a little bit to other types of doctors out there. What is the approach of naturopathic medicine, our principles, what's an office visit like? We'll talk a little bit about insurance and what it means to put a team of people together helping you with your health. Your health is the foundation of everything in your life. And the secret to living a symptom-free life, free of pain, free of depression, free of surgery, free of pharmaceutical dependence, is to create and maintain good health. The more involved you become in your own health, the more involved others will be as well. You deserve to feel good, to wake up with energy, to get good sleep, to move through your day pain-free. You also have the right to have people on your side helping you determine what can bring about your best state of health. And in order to make that journey easier, less expensive, and safe, working with the right people is important. Finding the right doctor or team of doctors is important in maintaining good health. Many people do not realize what all their options are when it comes to their health. This is one of the reasons adding a naturopathic doctor to your healthcare team is important. They will be able to provide you with a comprehensive picture of all the choices you have and be able to guide you. Unless you are facing an emergency situation in which you need immediate life support or a surgeon, you can choose from a wide variety of highly trained and skilled doctors. You're entering into a partnership with each and every person who is your doctor, so it is important that you select people with whom you can build a solid relationship, people you trust, and most importantly, with people who are knowledgeable in all areas of health. Selecting a doctor that you feel comfortable with and that listens to you, and one that lets you be an active participant in your health is very important. The doctors you choose should be able to educate and teach you how to do this for yourself. It is important to create independence, not increase dependence on the medical system. And good health is affected and created or destroyed by everyday lifestyle choices. So having a doctor who can educate as well as treat is a very important part of staying healthy. And this is what preventative medicine is about. If you're not improving, then talk to someone else. This is simple if we look at it from a different perspective. Let's say that you hire a plumber to fix the leaking pipes in your house. So he comes out and does some mystical plumber thing, and the leak stops for a few days. So you call him back when it is clear the leak has come back. So he comes again, charges you another service call, and this time, a couple of hours after he leaves, the leak is back. Well, how many times are you going to call that plumber? So it's the same with your health. A new and different perspective only adds information and knowledge, and puts you in a better position to make important health decisions. Therefore, it's really important to find doctors who are willing to work together. They must have mutual respect for one another, and In today's healthcare field, more and more mainstream doctors are willing to work with different types of practitioners. If your doctor is not willing to be part of a team, then it may be time to consider replacing him or her with someone who is open to that. When you go looking for another doctor to add to the team, be sure and ask what they think about alternative therapies. Don't be afraid to tell them what you're doing. Building a team of people that can help you achieve optimal wellness is your right. Often my patients are curious about my education. So I'll tell you a little bit about the different major medical schools, including naturopathic medical schools. We cover this in greater detail in our naturopathic doctor presentation, but we're going to look at 6 schools, 3 naturopathic medical schools and 3 mainstream schools. And first I'll just briefly show you the basic sciences, which include things like cell biology and anatomy, biochemistry, pathology, pharmacognosy, clinical physical diagnosis, all of this sort of stuff. And when we start looking at the number of hours that are taught in each of these schools, we can see that they're very comparable. For some schools, it's a little bit more in the naturopathic, and for others, it's a little bit more in the mainstream. We also have things like allopathic therapeutics. So we're called naturopathic doctors, and our MDs are called allopathic, right? It's a different way we phrase the type of medicine we practice. And it includes things like dermatology, family medicine, psychiatry, radiology, pediatrics, gynecology, neurology, surgery, things like that. And when you compare the hours between the schools, again, you can see that in some cases it's very comparable. Now, we in naturopathic school go a little bit further and make up some of these hours by doing naturopathic therapeutics, which is homeopathy, hydrotherapy, clinical nutrition, other advanced naturopathic therapeutics, and therapeutic nutrition makes up the rest of the hours. You can see in the mainstream schools, they really don't get anything in school while they're learning in the classroom. There's also some counseling that's included, and for the mainstream schools, that is included in their allopathic therapies. So basically, when you look at the bottom line, it's very comparable between the schools, and the big difference comes in the clinical training and in the learning more and different tools to address health. So when we start looking at the 2 kinds of doctors, so medical doctors, and I put osteopathic or DO doctors on the side of medical doctors, although many of them these days are practicing more holistically. You can see that we have the similar requirements of a bachelor's degree, a 4-year medical school, residency programs. And the real differences start to come in when we start looking at the actual practice of the medicine itself. So an office visit with the mainstream docs runs from 10 to 20 minutes, and I'm very generous when I give it 20 minutes. With a naturopathic doctor, you're looking between 45 minutes and 2 hours in that first visit. They're both using standard diagnosis. The mainstream is really focusing on treatment of disease or managing symptoms, while the naturopathic side is looking at the underlying cause and trying to treat the patient as a whole. And they both can have insurance coverage. The philosophy between the 2 types of medicine varies significantly. So on the one side, mainstream medicine is trying to identify a disease based on a list of symptoms or lab work. The naturopathic field is looking at the cause of the disease based on similar types of workup. There, of course, is a health history anytime you go to the doctor, and when you're working with a naturopathic doctor, you're really giving a very extensive health history so they can gather all the pieces of the puzzle and try and put together a cause and understand why things happened. The main treatment you're looking at from mainstream medicine, of course, is pharmaceuticals. And with the naturopathic medicine, we have a range of healing modalities that we bring: herbs and food and homeopathy and the use of water called hydrotherapy. And even though you hear a lot about preventative medicine being important, it's really minimized. Once you get in there and you start working with many doctors in mainstream medicine, the first things that they have you do or the things they talk with you about are not really preventative oriented, whereas in naturopathic medicine, preventative medicine is emphasized. So we're talking about the naturopathic approach, right? The core of naturopathic medicine. It's really a distinct primary and adjunctive healthcare system in and of itself. It uses safe and effective natural therapies, and the methods include modern, traditional, scientific, and empirical methods. It focuses on correcting the cause of disease, and it's governed by 6 naturopathic principles. It utilizes a combination of healing modalities. So, what are these naturopathic principles? Well, first, do no harm. And naturopathic medicine uses therapies that are safe and effective. When we introduce something to the human body, we want to make sure it's doing good and it's not doing harm and it's not creating negative side effects and deeper disease. Treat the cause is the second principle. This is where we look for and find the reason why this human being in front of us got sick. And if we can address the underlying reasons why that disease has happened, then we can get rid of the symptoms because the body is now functioning as it should. The healing power of nature. So we know, all of us know this, right? That the human body possesses an inherent ability to restore health to itself. And a very good example of this is if you get a scratch or cut yourself and you keep it clean and you leave it alone, the body's going to heal that all by itself. It has that knowing, that ability inside of it to heal itself. And oftentimes when you are working with the healing power of nature, you're simply giving the body what it needs to do that job better, or removing obstacles that are keeping it from healing itself. The fourth principle is treat the whole person. There is an individualized process within each person that leads to health or disease. If I had 100 people come into my office, all with the symptom of having a headache, right, or joint pain or fatigue, to think of it that every single one of those people has that symptom, right, because of the same reason, just doesn't make sense from a biological perspective. Therefore, it doesn't make sense to treat each one of those people in the same way. We are all human, and there are similarities in our biology because we're human. But there are differences, and those differences are of incredible importance when you're putting together a treatment plan for somebody. The chances that those people, say those 100 people, all have a headache, the chances that they'll all walk out with the same treatment plan from a naturopathic doctor are slim to none. And there are a number of tools that can be used to restore health, to find, right, the underlying cause. And as a naturopathic doctor does this, the fifth principle in naturopathic medicine is that the doctor is a teacher, right? It's our primary responsibility to educate, empower, and motivate our patients to understand what creates health and what leads to illness, so that we can help them take responsibility for their own health, thereby reducing dependence on a medical system. And last but certainly not least, our sixth principle, prevention is the best cure. We are taught to be preventative medicine specialists. We are taught to stop something before it goes too far and causes really serious illness. So what is an office visit like? Well, 45 minutes to 2 hours is usually the average time that you spend with a naturopathic doctor who's trying to get your history and all your symptoms and understand all of the things that happened and went wrong that led to what symptoms you're experiencing. So we really have to understand. Now, often something can be done to help ease those symptoms that a person has come in with, but we go way deeper than that, right? Naturopathic medicine directs us to figure out that individualized healthcare plan so that it addresses the underlying cause of illness and restores health. Thereby, someone is able to avoid having to take things for the rest of their life. There are follow-up appointments that are needed because we have to follow, right, the progress of someone's health journey, make sure that things are changing and healing and the person's improving. And so just like mainstream medicine, we might use lab work to monitor. We could use it to find the underlying causes in the beginning. But ultimately, the goal is to return a person to a state of health where no or minimal therapy is necessary. We often talk about licensing in the U.S. because not all 50 states are currently licensing naturopathic doctors. And it's important to the public to have every state license naturopathic doctors because licensing brings about a regulatory board. And that board makes sure that naturopathic doctors are staying within their scope of practice, right? They're not doing things that they shouldn't be doing and that they actually know how to do things they say they know how to do. And there are a number of states that do license. So on the map, you can see all the blue, right? Those are where naturopathic doctors are licensed. And there's a number of states where there's licensing efforts underway. And we need all the help we can get. So if you have legislators that you know, if your state is an unlicensed state, you can contact the state association, the Naturopathic State Association, and help out. If a state is not licensed, anyone can portray themselves as an ND or a naturopath with or without the appropriate training. Now, I'm not saying all of those people do harm. There are a lot of very good holistic health practitioners out there, but to call yourself a naturopathic doctor means something. It means you went to a naturopathic medical school, one recognized by the Department of Education. It means you had clinical training. It means you took national board exams and that you met the criteria to hold a license to practice medicine. And these things are really important when you are considering how you're going to address your health and who you're going to work with. You have a right to work with someone who's saying they're trained a certain way and now you know they are trained that way because there's a law that licenses them. I also get asked a lot about insurance. Right? So often in a state where a naturopathic doctor is licensed, there is coverage. It varies between insurance carriers, but most PPO companies offer, to cover those services. Also, Health Flex, health savings plans, cafeteria plans, those sorts of things, those sorts of plans will cover the services. And there's an issue we start to get into when you talk about insurance, and that is the insurance companies, once they get involved and they offer direct coverage, that is where your doctor's office files the insurance for you. The insurance company can sort of dictate how much time the doctor can spend with you. And this becomes a problem in naturopathic medicine because we have to spend time with our patients. So many naturopathic doctors will give you a coded super bill that you can file with your insurance company and get reimbursed at whatever rate they'll reimburse you for. Sometimes when I'm talking to patients and they comment on the cost of naturopathic medicine, and how it may or may not be covered by insurance, I tell them this, and this, with just a bit of research on your own, you'll see that this is the truth, and that is you're going to spend the money one way or another. Either you invest the money in building health and creating wellness and decreasing your dependence on the medical system and on pharmaceuticals, or as you progress through your life, if you haven't been eating healthy and living healthy and addressing those underlying imbalances, you end up in a place where you're spending that money now on procedures and pharmaceuticals and long-term care and things like that. So it's a choice everybody has to make. The type of life they want to live, the quality of health they want to enjoy throughout their life starts as early as you can start addressing it. And if you wait, you're going to spend the same money. It's just you're spending it on different things and a poorer quality of life. So in naturopathic medicine, one of the things that works very well is when people have a healthcare team. It's a very individualized experience, and there's a lot of folks out there who have specialties in different areas. And there are different types of primary care physicians, right? We have MDs, medical doctors, DOs, osteopathic doctors, and NDs, naturopathic doctors. All three are recognized by the Department of Labor as primary care. Part of the problem in people not really knowing about or understanding naturopathic medicine and naturopathic doctors is that not every state is licensed. And so in about half of the U.S., you have a good understanding of who these doctors are and how they're trained and what naturopathic medicine can do for somebody's life and health. And then in the other states where there's not as many NDs or there isn't licensing, the education hasn't been as thorough and complete because there's not enough people to do it. And so there's less of an understanding, but they are all considered primary care. The ideal situation is to have different people on your healthcare team, right? Folks who understand nutrition and people who understand health and finding the underlying cause, but there's also people on your team who can address critical urgent situations, maybe a surgery or an auto accident, something like that. Or if you've had some type of surgery or you have a condition where you require ongoing mainstream care. And then there's other people. You have chiropractors and massage therapists and a number of different folks who have a lot of valuable skills to bring to helping you build your health. The more people who collaborate for you, the better your chances are for improved and ongoing health and wellness. If you already have a primary care physician, you may want to enlist a naturopathic doctor to weigh in on addressing natural therapeutics, on finding the underlying cause of disease and correcting that. Lots of folks have both MDs or DOs and then a naturopathic doctor. And naturopathic doctors can address a number of different issues, right? We can talk about lifestyle changes, preventative medicine, allergy sensitivities, diet, nutrition, exercise, boosting the immune system, environmental medicine, and then, of course, bringing all of our skills based on our philosophy of finding the underlying cause of illness and educating and restoring health. The most important aspect of your health is you. And as you think about whether you want to bring naturopathic medicine into your life, there's some things that you can ask yourself, right? Are you getting the best care possible? Is your physical, mental, and emotional health all being addressed and understood by your current team? Are you seeing positive improvements over a period of time? Do you feel that you're being listened to and taken seriously? And are you comfortable with your treatment? Do you get to be an active participant in your health and do the things you want to do and find out about treatments you're really interested in? And do you feel you're being educated as well as treated so that over time you can do this for yourself? In naturopathic medicine, this is of paramount importance, is to make sure our patients understand what their choices are, what's happening, and what they can do on their own. I'd like to thank you for this brief overview of naturopathic medicine. And if you're interested in reading further, there are some resources here: the Organon, Homeopathic Philosophy, Natural Therapeutics, Nature Doctors. There's some websites and other resources for you here. From the national organizations to an organization that lists all of the approved and accredited naturopathic medical schools. If you're looking for an ND, the last website, medicinetalk.org, we have a Find an ND service there. And our resources that we used. And finally, I just want to say that all of the people at Medicine Talk are very passionate about spreading the word of naturopathic medicine. And each of us have our own reasons for working with and being dedicated to Medicine Talk, but ultimately it's about educating as many people as we can so that people understand that they have choices and that there are many different ways to address health and disease and to create wellness. Feel free to reach out to any one of us with comments or questions, and you can find our contact information for each one of us at medicinetalk.org, or you could find us through our general company email, which is customerservice@medicinetalk.org. Feel free to send us comments or suggestions, questions, things you'd like to know about. We love your suggestions, and we really encourage you to tell us what you think. And most importantly, we would greatly appreciate you telling your friends, family, clients, colleagues, everybody about the work we're doing. Like us, follow us, share us on all your social media, because together with your help, we can tell the world. Thank you so much for joining us today, and we look forward to our next visit together.